Welcome back to Making It Awkward. I'm your host, Jessica Wilson. We all did a deep dive into the examination and the Washington Post coverage of dietitians. Now, I want to take a sec and talk about how diet is communicated to us by the news media. Before we get started, thanks so much for the feedback on my episode with Deb. I'm glad it resonated with all of the troublemakers and troublemakers-to-be. I'm also glad that folks felt seen in the feedback I'd gotten from that keynote. I also heard from former Equip employees who were unhappy with the company and some who were treated poorly. I learned that some people were asked to sign NDAs or non-disparagement agreements in exchange for any severance offered, and that Equip had also fired its DEI manager earlier this year. Some folks would like to share their experiences at Equip anonymously for another episode about the eating disorder field. If you or someone else wants to add to that conversation, you can email makingitawkwardpod@gmail.com. Additionally, someone asked if Equip ever made a statement about the ad, but I don't know and didn't look for one because I truly wasn't invested in accountability. The ad was a perfect illustration of what's going on in the field, and so I used it. People use ads to illustrate concepts all the time, and this wasn't any different. With that, we're on to today's topic. Today, I want to chat about NPR and what they told us to do to be healthier in the last year. You'll hear my thoughts today and also some of the Instagram reels I made about this series. On May 14th, 2023, NPR's Allison Aubrey introduced a new series called Living Better: How Americans Can Take Back Their Health. I followed the series as it gave us a big nod to health disparities that were exacerbated in the pandemic. Today, I share what I found, what it means if we were able to take back our health, and the wildest nutrition advice I've heard since Dr. Robert Lustig told me that eating no food is better than eating processed food. So what's your answer?
So actually, I think no food is better than bad food. If those are the two choices.
Yes, that is often what I am working with.
If those are the two choices, I actually think no food is better than bad food.
Back to NPR. The story says, quote, "The disparities can be seen within zip codes in the same state. And while access to health insurance and good medical care is important, it doesn't ensure good health without access to some basics, such as having a job or a safe place to live and go to school. In fact, lots of research shows that poor health is driven by key social determinants, such as stress, trauma, social isolation, racism, poverty, and the lack of access to healthy food and other resources. For many Americans, the system is often stacked against their efforts to stay well." The series said it will have 4 main areas of coverage. 1, environmental causes. 2, community solutions. 3, individual tips. And 4, medical breakthroughs. My interest was piqued because of how great an opportunity it was to see what a newsroom could put together to address health disparities if they took a full year to investigate. But we were told the series would be about stories to help us take back our health. Womp. I had my critiques. Mainstream news is dying. In addition to pretending there's objectivity and 2 sides to human rights issues, here's another reason I'm not mad. It continually shows us it's completely unable to understand the complexities of anything that is health related. The idea that Americans can take back our health is just proof that they don't understand that we never had it to begin with. We will never be afforded health. That's how white supremacy works and the medical industrial complex. And what started off well, talking about zip codes, makes me think that they'll be able to talk about health disparities, and then it goes awry. The idea is that we can do it for ourselves, pick ourselves up by our bootstrap nature, that we can eat and exercise ourselves out of systemic racism, stress, trauma, lack of sleep, genetics, epigenetics, lacking income inequality, lacking healthcare, lacking safe schools. I could obviously go on. It's ridiculous. This series is focused on hope. It's looking at communities who are doing it for themselves. They're not calling it survival. They're not calling it safety. They're not calling it stepping in for a federal government that refuses to invest in communities of color, marginalized groups, and chronically underfunded systems. This series claims it wants to look around. What news media needs to do is look in the mirror. It needs to look at who's pitching these stories. It needs to look at who's in the research. It needs to look at who's doing the research and what the real problems are. But I was still open to a series that would be going on for a year. Maybe things would get better than my pessimistic heart expected. And then they aired their first story after announcing the series. about a teen taking Ozempic. I had obvious concerns. There's so much to say. I'm going to stick to the journalism and give 3 ways that this could have been a better, more helpful, more complex article. The first thing this article could have been about is why we're prescribing drugs to kids without long-term data. And 2, why we're recommending surgery to children that causes malnutrition. They acknowledge that the drugs are new, and past diet drugs have had adverse effects. They also led to weight regain. There's bariatric surgery, which they say has complications, including malnutrition and weight regain. Make it make sense. The second thing this article could have been about, if we're talking about taking back our health, is why we're focusing on shrinking. Shrinking is losing. We're not taking anything back. We're giving things away. We're losing our metabolic rate, we're losing nutrients, and in some instances, we're losing parts of our organs. Third, and perhaps the most egregious miss, this article could have been about bullying. The article goes on and on about the bullying that children experience. And for some reason, the chubby kids are supposed to get diet drugs and weight loss surgery because other children, teens, and doctors are bullying the child. Bullying is the issue. The issue is not the chubby kid. What we're doing is condoning the bullying of chubby kids. We're saying it's okay to put kids on under-researched drugs and give them surgery because other people have a problem with their weight. Journalists should catch this. Even if they don't know the answers, they should know to be asking these questions. That article was very much what happened in Oprah's special. Treating weight stigma with prescription drugs, treating fear with prescription drugs that haven't been well tested, and making it harder for people who relied on the medications to treat their diabetes. How would this address the differences in what goes on in different areas of the same city? How is this even an individual solution to health disparities? If anything, it could exacerbate health disparities because the people more likely to have diabetes are those who have less access to healthcare and live in the zip codes NPR alluded to. So many of my patients with diabetes have difficulty getting their Ozempic or Mounjaro or whatever because it's going to people who will pay whatever it costs. And this was how the series started. Of the 43 stories archived to this series, 4 of them were specifically about Ozempic, the last of which is an opinion piece. There were 2 stories on intermittent fasting. There was one on the keto diet, a bunch on ultra-processed foods, or UPFs. We also got something on multivitamins, Tai Chi, cleaning your own indoor air, something about mindfulness, and another about loneliness. And there was also one about a cold plunge. On May 25th, we got the first story specifically about UPFs, filed by Maria Godoy, which, as you know from my earlier episodes on this podcast, inspired me to go on a deep dive into the available research on UPFs, only to find that we don't even have a clear definition for them, which should make it inappropriate to have conclusive statements about them. But oh no, that won't stop journalists from speaking specifically and applying correlation to causation, and thus providing us recommendations. This first article referenced Dr. Kevin Hall's work. He did a singular study of 20 people who were willing to enter a research hospital and stay for 4 weeks while their food was provided and consumption was monitored. For 2 weeks, they were given an unprocessed diet, and 2 weeks given an ultra-processed diet, both matched for nutritional content. I'll keep this brief here and link to it in the show notes. The research left Dr. Hall with more questions than answers, and many follow-up studies he'd like to do to see if he can find the causation of it all. The article doesn't focus on how much about food and bodies we don't know. The article doesn't mention that Kevin Hall himself still brings a microwave meal for his lunch each day, which he knows has ultra-processed components. The title of the article was called What We Know About the Health Risks of Ultra-Processed Foods, and I had an answer and some questions. I'll save you 8 minutes of your life. The short answer, nothing. As a reminder, this series is supposed to be about taking back our health. You know what this article could have been about? The weird way that some guy in Brazil developed the scale to decide what makes an ultra-processed food and why we are using it as if it's science, using it to classify foods, using it to deem which foods are healthy and unhealthy, using it to moralize food. What I'd want to know if I were a journalist is why, if we were so concerned, and rightfully so, about an infant formula shortage last year, why we're using the scale to decide that infant formula is an ultra-processed food, therefore unhealthy and should be avoided. And if I were a journalist, what I'd want to know is why we're not talking about Hailey Bieber's skin smoothie, where we can apparently eat hyaluronic acid, add vanilla collagen, and vital proteins, whatever that means. But of course it's not. It's about anti-fatness. It's about race. It's about poverty. It's about class. Weird, rich, white people should be adding ultra-processed nature or mud/water to their food to become healthier. It's not about health. Then we were introduced to the truly baffling concept of anti-dopamine parenting, which tells us how we can make our children not want to eat sweet foods. But in both my personal and clinical experiences, these methods can simply make people, especially kids, eat larger quantities of the foods that we're told we should be avoiding. Anti-dopamine parenting? What is happening? Supposedly, if we cut off the dopamine to our children's brains, it will curb a kid's cravings for both sweets and screen. Not only is this ridiculous, when it comes to sweets, it's just not true. Again, this Healthy Living series made attempts at addressing health disparities, looking at some zip codes versus others, and now we have the idea that if we rip away some joy or desire from our children's lives, they're going to be healthier. The article acknowledges that dopamine responses have historically been a tool for survival, for things like water, safety, social interactions, sex, and food. But today, apparently, dopamine is supposed to be pathologized and problematized. Now, let's just get to the part that's not true. For those of you who have read my book or follow me in my life, you know that I have a mentee named Lexi. She's in her mid-20s now. And when she stayed with us during COVID, we went to the grocery store. She bought a bag of bulk peanut butter cups. Came back, started watching television with my spouse. I walked away, did something, came back, the bag was gone. What happened there? Growing up, she wasn't allowed sweets, sugars, anything that was considered a candy or sugary. So instead, when you can, you get a large quantity of a candy, sugar, sweet, whatever it is. Eat it all at once because you're not supposed to eat it tomorrow. You really weren't supposed to eat it today, but let's eat it all in one sitting and pretend like it never happened, because you don't often want to eat anything later in the day, and perhaps not the next day either. This is the false sense of scarcity that is imposed on many of my clients, many of us in general. People develop an all or nothing relationship with sugar. There is no middle ground. Kids don't learn how to moderate their intake, so instead of curbing cravings, they actually increase, as does consumption. After these two stories, I hadn't even realized that it was a primer for the UPF circus to come. It was late July, while on a morning walk with my dogs, that I heard the interview with Dr. Chris Van Tulloken about his book and personal experiment. On July 24th, this story for NPR's morning news show was titled, "An Ultra-Processed Diet Made This Doctor Sick. Now He's Studying Why." And on July 25th, for the evening news, the same thing was titled, "What Happened When a Doctor Only Ate Ultra-Processed Foods for a Month." But Van Tulloken didn't eat only UPFs. It was 80%. I was inspired. Apparently, NPR wasn't done. I've got 3 things on this and then a special bonus. First, 80% is not only. I think that's simple math. Second, this guy is not news. Shout out to his PR team. Every major news outlet that I've seen lately has been covering ultra-processed foods. And his book's a bestseller. Elitism and sensationalism when it comes to food sells. And also, number 3. This is clearly about race, class, and access. We have the same examples of ultra-processed food that we hear time and time again. It's soda, it's sugary cereals, it's microwavable meals, things that are easy and low cost to make. And again, we can't forget those babies who just all day long are eating ultra-processed food. But when a doctor decides to have 80% of his calories come from ultra-processed foods, it's somehow news. And as I've discussed in earlier videos, the criteria for what makes an ultra-processed food is incomprehensible. So, if that doctor can make news headlines for eating only processed foods for 30 days, so can this dietitian. So with the help of a food engineer, we'll try to make sense of these guidelines and come up with a way for my diet to have even more than 80% of my calories come from ultra-processed foods. The ultimate what I eat in a day. I'll show that it's really about race, class, elitism, and access. So, Alice and Aubrey, Dr. Van Tulloken, NPR, I see you and I race you. I'm glad I got to share the experience and what I learned with y'all in some of the first episodes of this show. I drank my normal oat milk, had gluten-free bread, and added microwave meals, Olipop, protein powder, vegan cheese, and a ton of meals from Costco and Trader Joe's, in addition to the Cheetos and chicken nuggets I ate that month. What I also had were non-starchy vegetables because they have minimal calories. And if 80% of my calories was supposed to come from ultra-processed foods, these non-starchy veggies weren't going to make a difference. I said I was going to show it was about race and class. And more than once I heard, but it looks like you were eating the healthy ultra-processed foods, which proved the point. If Van Tulloken got sick from UPFs and I felt better, it can't be because I was eating vegan cheese and drinking Olipop. His diet and mine had fillers, flavors, thickeners, and preservatives. So was Van Tulloken's story news because he was eating the foods we associate with black and brown poor people? What a far more enticing news story it is to talk about a doctor choosing to eat like those who can't afford food and don't get choices. And then only a few weeks after Van Tulloken's article, we got a story on fiber sodas like Olipop. We're told that, quote, if you enjoy these prebiotic drinks and they help you meet your daily fiber targets, they could certainly fit in as a part of a healthy diet, end quote. This was from Hannah Holscher, an associate professor of nutrition at the University of Illinois and self-proclaimed fiber nerd. But those fiber cereals are UPFs. It's all just too much, and quite a start to the series. But then, in the fall, things started to fizzle out and stories weren't published at the same frequency. After getting 50% of the Living Better stories in a 4-month period, we got the remaining from August to February. The last Living Better series story was filed in February. It's the opinion piece called Weight Loss Drugs Aren't a Magic Bullet. Lifestyle Changes Are Key to Lasting Health. I will say that there were a couple of stories that may have been in the policy community solutions category. One talked about teaching kids about cooking and growing produce, which sounds great, but it also has this teaser. Quote, with diet-related disease on the rise in the US, some schools are adding nutrition to the curriculum. Teaching kids to grow and cook fresh produce can influence lifelong eating habits. And I'll ask you, do kids only get to grow food and cook because the country is getting sick? But that's where we are. I also learned about the Healthy Steps program in November. Another story that could be in the policy or community category was from September, titled Prescriptions for Fresh Fruits and Vegetables Help Boost Heart Health. It says that researchers evaluated the impacts of produce prescriptions, which provide free fruits and vegetables to people with diet-related diseases, including diabetes, obesity, and hypertension. I just happen to be familiar with these kinds of programs. In the Bay Area, we have Project Open Hand. I had a patient in this program. She was older and had been enrolled for a few months and saw a dramatic improvement in her blood pressure. She was also getting other food delivered through a food bank service. And then, just a few months after working with her, she wasn't able to renew her paperwork. And to top it all off, she'd stopped going to the cooking classes and support classes because she was experiencing anti-Blackness in them. I hadn't realized that this was the only food that she was eating. Before these programs, she didn't have any. And she was too ashamed to tell her children she didn't have enough money to buy food. So she just stopped eating. But the barriers and gatekeeping to these type of produce prescription programs or any other food assistance aren't in the story. Instead, we get the idea that these grants and programs are able to fill in the gaps that capitalism has left wide open. Everyone's able to make healthy choices with these programs. And it's really fucking hard to listen to these stories without the additional context. Relying on food charity and grants is not the way to reduce health disparities for all. They sound good. The data is good. This might be a success story for a small group of people. And I'm glad for them. But can we use that as the case for universal basic income, for universal healthcare, for safe places to play, and so many other things? The end is not charity. The end is not grants. This story is not the end. Even though I may have been frustrated at how easily correlation was summarized as causation in this series, and though much of what was presented was done so in a way to garner clicks and giggles so far, I was not prepared for my own reaction to Alice and Aubrey's article on blue zones. The blue zones are 5 communities around the world with the highest concentration of people living to and over 100 years old. These communities are isolated from convenience and technology. They're community-oriented and have a diet of mostly whole grains, vegetables, greens, beans, and tubers. A story in the series that aired in September and was updated January 1st quotes Dan Buettner, a guy who has studied these communities for decades, saying that, quote, people in blue zones, they're not thinking about their health or a diet or an exercise plan. They're not doing anything except living their lives, end quote. So these folks are just chilling, and something in the environment and their bodies are vibing in ways that make them likely to live longer. That's interesting. They're not like taking steps or anything to be healthier. That doesn't really fit with the series on individual solutions. That doesn't really fit with this series where we're supposed to take back our health. Not to worry. Buettner and Aubrey are still able to come up with 7 habits to live a healthier life. Swap 1. Trade the lazy boy for a mat and a garden. Sitting on the floor is something that Buettner observed keeps people strong. Swap 3. Reduce meat and aim for a plant-forward approach. 4. Give loneliness the boot. Become a joiner. 5. Revamp social media to cultivate friends and a sense of purpose. Swap 6. In lieu of an afternoon espresso, take a nap. Swap 7. Trade big city rents for an affordable home and maybe keep your parent nearby. You'll notice I saved swap 2 for the end. Ditch DoorDash and eat like a peasant. Buettner says, people in the blue zones are eating the cheapest peasant foods. What? I definitely needed to pause a sec and go look up the definition of peasant. I am sure I was misremembering. But according to Merriam and Webster, a peasant is either a member of a European class of persons tilling the soil as small landowners or as laborers, or a usually uneducated person of low social status. I just cannot. In an entire series that was supposed to have touched on health disparities and constantly told us that the food that most poor people eat is the unhealthy kind, now we get this. A statement telling us that we need to be eating the cheapest of peasant foods. It feels demeaning and dismissive to me. For Aubrey and others to, over months, tell us how terrible cheap food is, to then turn around and chuckle about the cheapest peasant foods seems disrespectful and just sad. All along, the series had been signaling that it wasn't actually for poor people, but this story made it clear. If buying cheap food made us live to 100, the correlations with populations and longevity would be reversed. The poorest people who spend the least amount of money on food would live the longest in the US. I can only imagine the giggle that listeners got with the idea of them eating like peasants. Such a good line for clicks. But considering the NPR audience, it just makes sense. And according to marketing information published in 2021 by WEKU in Lexington, NPR listeners are 54% more likely to purchase food labeled as natural or organic. They're 104% more likely to work in top management, 69% more likely to be C-suite, 113% more likely to be a self-employed professional, and randomly 85% more likely to have gone backpacking in the last year. According to the New York Times, that in 2020, the Pew Research Center found that of the people who named NPR as their main source for political and election news, 75% were white, while only Fox News kept that top spot. And then, to top it all off, proudly, media database, recently named Allison Aubrey as the most influential nutrition journalist in the country, which she shared on Instagram.
I'm currently the top-rated nutrition journalist in the country, a ranking I earned because I cover science, not fads. If you want to eat a longevity diet, you got to pack in more grains, more nuts, and more healthy fats. And you got to eat less of this, ultra-processed foods. This is a snack pack that I picked up on a Southwest Airlines flight yesterday, and I get it. People like this stuff. My own family does. But it's full of refined grains, lots of sodium and sugar. And there's more at stake for your health than you might realize. I just talked to the researchers behind a new British Medical Journal study and found people who eat a lot of ultra-processed food have more depression, more anxiety, have higher rates of certain cancers, including colorectal cancer, and more premature death. More insights below.
Aubrey says that she covers science, not fads. And I will say, she talks to experts and reports what's in research studies. So that would be science. And her interview with Dr. Chris Van Tulleken about his book, Ultra Processed People, was definitely giving fad. His book reviews were first published in the Daily Mail, a British tabloid where his wife just happens to work. There were multiple stories with dramatic accounts of his 30-day experiment and the effects on his children and his wife. It was giving human interest story with a side of science, but it did wonders for his publicity, which then became mainstream news across the pond. And also, eating like a peasant seems more fad than science. Now, as someone with a master's degree in human physiology, I'm just not sure how applying correlation without context, without accounting for social determinants of health, and coming up with actionable steps from something still ambiguous is science and not a fad. In Aubrey's April 3rd announcement clip, she shows the viewer an article she recently authored called "From Anxiety to Cancer, the Evidence Against Ultra-Processed Foods Adds Up." Funny enough, I made a video of that same article on March 20th, except mine was a bit different.
Is anyone finding it hard to look at the same news outlets who are reporting on the dangers of ultra-processed foods, also report on the meals ready to eat delivered to people who are being starved? It seems like it would need a large amount of cognitive dissonance and perhaps a lack of empathy to continue to talk about how these meals ready to eat are going to give us cancer, possibly depression, and just generally be unhealthy. If you're going to have a story about ultra-processed foods, can you also talk about the necessity of them for many people? I'm not saying the news has to stop, but if this isn't an indication that we need to be more intersectional, that we need to hold multiple truths at one time, that things can't be entirely black and white, I don't know what is.
During this period of weaponized starvation, I was and continue to constantly think about how the news media covers food, particularly ultra-processed foods. I especially think of the Dr. Robert Lustigs of the world and those who are influencing news coverage. I wanted to call Dr. Lustig and see if he still thinks that starving people should not eat ultra-processed food and instead starve. But he already told me the answer, and I don't need him to double down on why. It really felt like I wanted to give him another chance to show me that he believes in a shared humanity and that people, regardless of class, whether they live near a grocery store or not, and state-sponsored violence, deserve to live. But I need to believe him the first time and move on. And I need to somehow forget that he contributes to global food policy and has been on NPR multiple times. So, what did we learn from this series? Bake your own bread. Eat fruits and vegetables, but if you can't, fiber sodas are okay. Put your kid on Ozempic if they're experiencing bully and anti-fatness. Take a multivitamin. Try intermittent fasting. Build a garden. But don't eat peanut butter cups and stop being lonely. Don't eat fast food, but eat like a poor person. Most importantly, I think we learned who the target audience truly is and which section of the population NPR is most interested in serving, and to make sure the nutrition messages that they're sharing are skewed towards the interest of their listeners. And that's fine. Just say it. You're not interested in investigating health disparities. As previously discussed, it's just not sexy. The NPR audience is already going to believe that fruits and vegetables are good for you, that fiber sodas are fine, and that we shouldn't eat 80% of our calories from ultra-processed foods. So what was the point? Since the fizzling of Living Better, NPR and Aubrey have shifted their attention to a different series called How to Thrive as You Age, which is supposed to be about the science and secrets of longevity. It's giving blue zones and biohacking at the same time. Talking about health disparities is very over. It was very 2020 to 2022, which kind of makes it seem like it was a fad. And now it's just time to move on. Eating like peasants and latching onto the attention on longevity that biohacking has brought us is great for clicks and giggles. What I haven't said yet is that in my 17 years of clinical experience, none of this leads to the healthy choice being the easy choice. All of this leads to overwhelm. We see conflicting nutrition guidance in the same publication, in the same month, and maybe even the same week. It leads to overwhelm. People make no choice. And as we know, a few people believe that no choice is better than the bad choice, and I'm just not one of them. I believe food is better than no food. Over the course of this series, I reached out to Allison Aubrey, to Michaeline Duclef, who reported on anti-dopamine parenting, and Maria Godoy. And as of recording time today, they have not responded to my request for comment. To continue the conversation about what people eat, peasant food, the news media's obsession with processed foods, and intentional starvation, next week you'll hear my conversation with Malak Sadie, a Lebanese Muslim dietitian. Malak shares how she's doing now, what she's seeing, and how her professional experience intersects with weaponized starvation. I hope you'll come back for that incredibly important conversation. Until next time, make it awkward, friends. This has been Making It Awkward. I'm your host, Jessica Wilson. The best way to support the show is by rating, reviewing, and sharing it with a friend. You can become a sustaining Patreon member of the show, which will support the editing and mixing of our fantastical Jen Jacobs. You'll also get bonus content, extra dad content, and the satisfaction of knowing that this show will continue to go on. This is a production of The Body Politic and is supported by Patreon members like you and the legacy of Sacramento Outboard Services.